And now back to our lead story, the coronavirus. There has been criticism and concern from some experts about how the president, his team, and top public health officials are communicating important information to the American public. At times, the president has been at odds with what others say, or has made statements that are wrong, inaccurate, or lack important context. That happened on Friday when he visited the CDC and was asked about when Americans could be tested for the virus.
Anybody that needs a test can have a test. They're all set. They have them out there. In addition to that, they're making millions of more as we speak. But as of right now and yesterday, anybody that needs a test, that's the important thing. And the tests are all perfect.
In fact, some states can only do limited numbers of tests right now, and tests are still being distributed. A short time after the president spoke Friday, Vice President Pence offered a clarification.
We trust in a matter of weeks the coronavirus test will be broadly available to the public and available to any American that is symptomatic and has a concern about the possibility of having contracted the coronavirus.
So let's look at some of these concerns we're discussing around what is being conveyed to the public. Dr. Joshua Sharfstein is the Vice Dean at Johns Hopkins Bloomberg School of Public Health. He's a former Deputy Commissioner of the FDA. He's also the author of the Public Health Crisis Survival Guide, Leadership and Management in Trying Times. Dr. Sharfstein, thank you very much for joining us. How important is clear communication, accurate communication at a time like this?
It's incredibly important, because without clear, compelling, compassionate communications, people don't know what to do, and they can't take action necessarily to protect themselves and those they love.
So what does that mean is the responsibility of leaders, whether they are leaders in the political sector or in the health sector, or for that matter in the economic sector?
Well, communications is one of the central components of crisis response. And what it means is having, designating people who are credible and trustworthy to give information to the public, whether it's good news or bad news, with context, with care, with empathy, but telling it like it is. And if you don't have that, then people can become uncertain, they can lose trust, they can become fearful, and they can basically not do the things that they actually need to do to stay as healthy as possible.
In your view, is that the kind of communication you're describing taking place right now?
I think there are few people would say that this is really by-the-book communication at the moment. I think the concern is not only that there are mixed messages being given, but that some of the most credible and compelling people in the administration are not really leading the communications effort. And I'll give you an example. I think it doesn't matter the political party. Any politician, when they say something, they want to stick to it. And people say, well, if you change your mind or you say something different, that's like flip-flopping. But in a public health crisis, the circumstances might change, the science might change, the guidance might change, and an experienced communicator will be able to explain if something has changed, something different needs to be done. So it's really important to leave the bulk of the communications to people who can really put it in context, who have subject matter expertise, and who can really compel attention and trust.
I want to read something President Trump tweeted late this morning. As you may know, he has over 70 million followers on Twitter. This is what the president wrote. He said, so last year, 37,000 Americans died from the common flu. It averages between 27,000 and 70,000 per year. Nothing is shut down. Life and the economy go on. At this moment, there are 546 confirmed cases of coronavirus with 22 deaths. Think about that, exclamation point. I think the suggestion he's making is that the country, people don't stop doing the things they ordinarily do when there's the common flu, which kills, as he says, tens of thousands of Americans. We don't have those kinds of statistics right now around the coronavirus. Why should we be getting so exercised about this?
Well, the challenge is that there's no spin for a virus. The virus doesn't get the tweet. The virus is just doing what the virus does, and it's up to the rest of us to to take the actions necessary to control it. There's a lot of concern that this is a virus that is spreading. If you look at what's happening in Italy or other countries, we need to do everything we can right now to prevent that from happening here. The concern with just general reassurance is that people will lapse back into thinking this isn't something that I need to change my life around. I heard one person say that they saw some reassuring message on cable TV and decided to go ahead with a big party for a lot of people who are, over 70, 75 years old, where all these people are going to be traveling. Like, that's not good. It's putting them at risk. And so, it's better to be focused on, what could happen and how to prevent worse problems than just putting a gloss on the situation right now.
Well, what would you say to, just as an example, one of President Trump's followers on Twitter who reads that and thinks, well, the common flu kills many more people. Why should I even be concerned right now?
Well, this is a new virus. It's a virus that none of us have immunity to. It's a virus that is killing people around the world, and if it spreads like it's spreading here, many more people could die in the United States than from flu. And we have to do everything we can to prevent that from happening here, and particularly, the good news is there are things we can do. It's really important in communications not to have people feel either helpless or hopeless. So wash your hands, stay home if you're sick, cough into your arm, the sorts of things, even basic things. What can everybody do? Those really should be the most important messages right now.
Dr. Joshua Sharfstein of Johns Hopkins, thank you very much.
Thanks for having me.